Faculty of Physiotherapy and Diagnostic. So today the topic it's about malignant and non-malignant conditions. So what is malignant and non-malignant conditions? So malignant, it is a neoplasm, and a neoplasm, it is an abnormal growth of the tissues and also known as tumor. Tumor means like new formations of the abnormal growth of the cells, and a tumor, it is an abnormal mass of the tissues, the growth of which exists and is uncoordinated with the normal tissues, and the excessive manner after cessations of the stimuli which evoke the changes. So classification, basically it is two types of the classifications of the tumor. Firstly, a benign tumor and malignant tumor. Secondly, so a benign tumor, it is a non-malignant and non-cancerous tumor. A benign tumor, it is usually localized and doesn't spread to other parts of the body. But benign tumor are typically slowly growing, but mostly benign tumor responds fast to the treatment, and they have a defined border. So surgically removal can be effective treatment for the benign tumor. And however, some benign tumors can grow in the large and lead to the serious disease because of their size. Because benign tumor can also malignant tumor, and so far the reason are the sometimes treated. And also benign tumor can be serious because if they press on vital structures such as blood vessels or nerves, and sometimes they require treatment and other times they don't. So the next I'll discuss about malignant tumor. So a malignant tumor, it is a cancerous growth and usually fast growing, and was a abnormally growth of the WBCs for the immature WBCs, and they are often resistant to the treatment and may also spread to other parts of the body, and they sometimes recovery for they were removed after the stimuli. So what the difference between benign and malignant tumor? So benign tumor will differentiated cells and resembling normal cells of the tissues from which the tumor originated. But in case of malignant tumor, cells are undifferentiated and often bear little resemblance to the normal cells of the tissues from which they arise a malignant tumor. So what are the mode of the growth for which benign and malignant tumor? So that next tumor grows by the expansion and doesn't infiltrate the surrounding tissues, and usually encapsulated. And in comparison of malignant tumor grows at the peripherally and sends out of the processes to inflate and destroy the surrounding tissues. So rate of the growth is usually low, and malignantly rate of the growth is variable and depends on the level of differentiation, and the more anaplastic the tumor and the faster its growth. Because the abnormal growth of the WBCs and immature cells and hematopoietic stem cells tissues, so doesn't spread by the metastases in case of cancer, but gain access to the blood and lymphatic channels and metastasizes to other areas of the body. So the next I'll talk about general effects for the benign and malignant tumor. So benign tumor, it is usually a localized phenomena that caused generally effects unless in locations interferes with vital functions. But in the other hand, malignancy often causes generalized effects such as anemia, weakness, and weight loss. So the next level is tissue destruction. So the tissue destruction in case of benign tumor doesn't usually cause the tissues damage and locations interferes with the blood flow, but the malignancy causes extensive tissue damage, and blood supply and blood flows to the areas may also produce substances that causes the cell damage and also cell injuries. So what are the ability to cause of the death in benign and malignant tumor? So usually generally cause of death unless its location interferes with the vital of functions and also malignancy usually causes death unless growth can be controlled. So what are the next phase is nomenclature of the benign tumor. I'll discuss about of the next phase. So OMA, like it is the benign neoplasm. OMA, it is means the benign of the neoplasm. So mesenchymal tumor, chondroma and cartilaginous tumor, and also osteoma bone tumor. And next phase is epithelial tumor, epithelial cell tumor. So adenoma, tumor forming glands, and like a tumor that projects above the mucosal surface. And sarcomas, it is also mesenchymal tumor, and chondrocarcinoma, cartilaginous tumor. And in other I explained carcinomas, it is an epithelial tumor, because adenocarcinoma, gland forming tumor, and carcinomas can arise from the ectoderm, mesoderm or endoderm layer.